Wachter joins us now to talk about that and answer your COVID questions. Dr. Wachter, it is so strange not having you and your wife with us. We are so used to it. How has her COVID recovery gone? How is she now?
Thank you. It's not great. She's 4 weeks out, and she still is pretty fatigued every afternoon. She needs to take a nap, which she never does, and she's a very busy working journalist. You know what that's like. And so I'm hoping this doesn't become long COVID, but she certainly is not back to normal even after 4 weeks.
Oh, no, I'm so sorry about that. Well, on the topic of long COVID, I didn't anticipate having to ask you this question. I was hoping for better news. But are there some signs, some things that people should watch out for once they have, recovered and tested negative that are signs of long haul?
The definition of long COVID varies, but it really is you continue to have symptoms months out, not weeks. A lot of people will continue to have symptoms weeks out, but for someone who is continuing to have fatigue or brain fog or fevers months out, that's the definition. And there's no good predicting. It's clear that vaccination lowers the risk of that. It's clear that if your initial case was milder, your risk is lower, but not zero. It's clear that in many people it gets better over time. So even if you have symptoms for a couple of months out, the odds are pretty good that you'll get better over time. But we're seeing plenty of people who still have pretty bad symptoms 6 months out.
Well, let's hope that the positive part is the route that your wife is going to take. And speaking of, when we spoke about vaccinations earlier, one of the big headlines I read today was that the White House is saying COVID vaccinations for kids under 5 will start as early as June 21st. Is this realistic? Should all kids in this age group get this vaccine?
Well, I think it's realistic that it seems very likely that the FDA will approve the vaccines for kids at their next several meetings. There are a few different steps they have to go through, but that seems very likely. I think, parents then have a decision to make. If I had kids that age, I don't, but if I did, I would get them vaccinated. I think the risk of the vaccines is very, very low. And even though very few kids get super sick, some of them do. There have been kids that have died, and we don't know the long-term effects on kids. But when people ask me, I'm worried about the long-term effects of the vaccine, that I'm not worried about at all. We've now seen hundreds of millions of people vaccinated, follow them for over a year. I am worried about the long-term effects of COVID. So if it was my kid, I would get them vaccinated as soon as you can.
Yeah, undoubtedly. And I remember at the beginning of the pandemic, there was not that emphasis on children, and now we are seeing more kids getting infected. So it is a real concern for so many. I do want to get to a viewer question that came in on Facebook while we're on the topic of vaccines. Carrie writes in to say, thank you, by the way, for asking your question. We ordered a large quantity of test kits for our office. We received them last week and they expired June 14th. I can't get a hold of the seller. Are these test kits going to be okay after the sell-by date?
I hesitate to say that you should ignore that date, but the dates are often quite restricted. The same thing is true on medications where there are sell-by dates, but the medicine is just fine for a while after. If the thing were a year past its date, I'd worry. If it were a couple of weeks, I would not.
And I am getting another question from 2Cuss. That is this person's username. Do you think diet plays a part in your recovery?
I don't know the answer to that. I haven't seen any good studies looking at it. Obviously, it would be nice to just say, of course it does, and we all want to eat a healthy diet and get exercise. I have not seen a study that correlates diet to the recovery from COVID. Certainly, we know obesity is a substantial risk factor for bad outcomes, but in terms of the diet that you take when you have COVID or afterwards, it makes sense to eat healthily, but I can't give you any data on that question.
Yeah, almost sounds like a general rule of thumb, right? Healthy diet leads to healthier lifestyle. So we shall see. I am getting a question in about Alameda County, actually something that one of my producers flagged, because today Alameda County announced it'll be going back to requiring masks for indoor events starting on Friday. This is because of the surging. Are we reaching a point, do you think, with these spikes that maybe more organizations, cities, counties will bring back their mask mandates?
It's a tricky question. There are a lot of cases around. When you look at the Bay Area, there are as many cases now because we're counting so few of them in the public counts because of home testing, probably as many cases now as there were in December and January. The appetite for mandates has gone down tremendously. I personally think it's pretty risky out there right now. There's a lot of COVID, and I think wearing a mask in indoor places is a really smart thing to do. Our hospitals are not overwhelmed, and I think that will be the trigger for mandates in many places. I think it's probably a little bit safer to have a mandate if everybody wears a mask. I think that's probably safer for everybody. But you have the ability to keep yourself safe by wearing a good mask in an indoor place. So even without a mandate, I would encourage people to wear an N95 or the equivalent in crowded indoor places while there's this much virus around. There's a ton.
Yeah, I'm certainly seeing a lot of people, even at the grocery store, still masking up, even though they're not required to. I am getting a question in from Thor Ellie, who writes in on Facebook. I'm afraid to get the booster vaccine since I got very sick with the one I took back in June of 2021. How big is my risk of getting infected again?
Well, everybody's risk is pretty high right now. The reason to get the booster has less to do with protection against infection, although it helps some, and much more to do with the fact that your prior vaccines' effect in protecting you against getting very sick is waning. And so particularly if you're an older person or have other medical risks, the booster will markedly, and I mean markedly, lower the probability that you'll need to go to the hospital, get sick, and die. There's no question that there's evidence that boosters lower the mortality rate along with lower the hospitalization rate. So I think that for people that are eligible to get boosters, this is a very good time to get them. There's so much virus around. Good chance you'll get infected. Vaccines lower that chance, but probably more importantly, markedly lower the chance that you'll have a severe case.
Yeah, some really great questions coming in from Simone, Karen, and Randy. Another question about kids. Can kids suffer from long-term COVID? I know we touched upon that in the beginning of our segment.
Yeah, it's not been very well studied, but there certainly are kids who've gotten COVID who continue to feel ill for many months. I think we need better data on it, but it truly is one of the reasons why if I had a young kid, I would get them vaccinated, because I do think there is some chance that they will have long-term symptoms. There's some chance that having a prior COVID will increase the risk of other bad things down the line, and the vaccines are really quite safe. Yes, there are tiny risks of heart involvement that almost never have led to hospitalization. The heart involvement risk of COVID is greater than the heart risk from the vaccine. So it is one of the reasons that I would vaccinate my kid, worried about long-term effects of the infection.
Yeah, glad we got to that question. I wish I could get to even more, but it looks like we're running out of time. So Dr. Bob Wachter, always a pleasure. Thank you for joining us.
Thank you for having me.
Okay, we will be right back, everybody, but the conversation continues on Facebook.com/ABC7 News. We are going to be with a Boston donut maker issuing a challenge ahead of the NBA Finals. I've got a little bit of a connection. Stay tuned. More on that in a second.
Companies love using jingle.